If you're turning 65 and covered by a group health plan, which you can see the definition of here on the screen, this will come down to three key factors. Number one, the employment status of you or your spouse. Number two, the size of the employer that is providing the group health insurance. And finally, whether or not your prescription coverage through the plan is considered creditable for Medicare Part D. We will break down each of these right now. For employment status, you need active employer group health coverage either through your current employment or a spouse's current employment. And this is so you can delay Medicare Part B without penalties. Be careful here because COBRA coverage, retiree insurance, individual health plans like through the health insurance marketplace, and even VA coverage do not count as active employer coverage. And that's great and all for penalties, but the most crucial factor for our discussion today is employer size. Here is where things get particularly important.
I'm listening.
Once you become eligible for Medicare, it becomes your primary insurance if your employer has fewer than 20 employees and is not part of a multi-employer plan with other larger companies. In this case, your employer coverage, it becomes secondary to Medicare, which completely changes the game.
Change the game.
Change the game.
To be clear, if there are fewer than 20 employees at the employer providing your group health plan, you generally must enroll in Medicare when you turn 65. This likely is not optional if you want proper coverage. It doesn't mean you're forced to leave your employer plan, but again, Medicare will become your primary coverage going forward, with your employer plan providing secondary coverage. On the screen are actual letters that people have received from their small employer insurance plans, clearly stating that Medicare must be their primary coverage at 65. Without Medicare enrollment, your employer plan, it can refuse to pay claims that should have been covered by Medicare as your primary coverage, or the employer plan might just pay a small portion of the bill, leaving you with potentially devastating medical bills. How is this employer size determined though?